Hello and welcome to the Region 7 Zoomcasts, where we conduct interviews with our Region 7 colleagues to learn the perils and pearls related to our COVID-19 response in the hopes of sharing lessons learned and learning something new that we can all benefit from. My name is Angie Vasha and I am the Director of Isolation and Quarantine Services here at Nebraska Medicine. Today we are going to talk with Dr. James Lawler and Dr. David Cates in regards to the hot topic of home for the holidays, how to celebrate during a pandemic. So without further ado, please join me in welcoming our guests. Dr. Lawler.
Hi.
Dr. David Cates.
Hi, thanks for having us.
Thank you. Welcome and thank you both for joining us today. I would like to begin by having you tell our listeners a little bit about yourselves, and if you could elaborate a little bit on what each of you have been working on during this pandemic, and it will highlight why we invited the two of you particularly to speak about how to celebrate the holidays. So we'll start with Dr. Lawler, please.
Well, I'm James Lawler. I'm an infectious disease physician here at the University of Nebraska Medical Center. I'm one of our co-directors for our Global Center for Health Security, and I have been working on a bunch of things during the pandemic response, in part looking at how different community non-pharmaceutical interventions can reduce transmission risk in the community, also looking at what risk is in the healthcare setting for environmental and direct exposure, and then working on tools and solutions to try and help treat patients more effectively.
Great, thank you. And Dr. Cates?
Thanks. I'm a clinical psychologist. I'm the Director of Behavioral Health at Nebraska Medicine. I also serve as the Vice Chair of Clinical Services in the Psychiatry Department at UNMC. But another role that I have is the Behavioral Health Consultant to the Nebraska Biocontainment Unit and the National Quarantine Unit. And in that role, in addition to supporting patients, one thing I do is support the wellness and resilience of the healthcare workers who are part of those teams, because treating people with highly hazardous communicable diseases comes with a variety of stressors. And once the pandemic started, really all of our healthcare workers were facing the stress of treating patients with these diseases. So along with several colleagues here at Nebraska Medicine, we've been working on strategies to support the entire workforce.
Great, thank you. So I think the best way to start out is just to have Dr. Lawler talk a little bit about the CDC or public health measures that are being released to provide guidance around holiday gatherings. And if you could elaborate a little bit about your level of concern related to a potential uptick in cases, knowing that we're entering into, the festive winter holiday season.
Right, thanks, Angie. So unfortunately, we're already seeing a tremendous uptick in cases now in the fall across the United States and also in other places in the world, in Western Europe as well. In the US, we have been particularly hard hit here in the Midwest, where we've had dramatically increasing case numbers over the last 2 months, really. And we are now reaching unprecedented case numbers here in the United States, above the community transmission rates that we saw even in the spring in places like New York and Massachusetts and other areas of the country that were hit hardest. So unfortunately, we're now in the worst part of the pandemic for our citizens, and that's not only in terms of the number of cases, but it is also now translating into increased hospitalizations and deaths. And so we'll see those hospitalization rates and unfortunately fatality rates continuing to rise as well. I and many of our healthcare workers here are very concerned about what's going to happen to our health system over the next several weeks as we go into the hospital or into the holiday season, And then we're very concerned about how holiday gatherings would potentially amplify that situation and make it even that much more worse. So I think people really should understand that we're entering a very, very dangerous time where it is likely that we will not have enough hospital beds or staff to take care of the patients that we are about to receive. And that means that not only COVID patients will not receive optimal care, but neither will any of the other conditions that we normally deal with in the hospital every day. All of those people will be affected. So it's very important for people to keep that that in mind and to change their holiday plans based on the emergency situation that we're in. The CDC has come out with guidance recommending that people not get together with large family groups or other gatherings over the holidays. The CDC recommends, and I agree, you should keep your gatherings to your household and your immediate family, and you can certainly use other methods to communicate and commune with family members using video chat, etc. But it is a really dangerous time to bring folks together from different households because that will amplify transmission in the community.
Right. Thank you for that kind of update, and then just kind of the overview of what's being recommended by our public health experts. I want to ask Dr. Cates, in regards to all of these things, and we think about the emotional impact that these public health measures have, and not just the recommendations to decrease gatherings, to limit interactions with those outside your household, but also as the public becomes more aware of this somewhat dire situation that we're facing in the hospital setting. Are you concerned about the emphasis on these measures and the seasonal affective disorders that we typically see this time of year, the stress of the holidays, that all of these things will continue to exacerbate the feelings of depression or loneliness that we already see this time of year? And if so, do you have strategies that you would recommend to people to help them, increase resiliency and really cope effectively during these really stressful times?
Yeah, that's a really two important questions. So first, I would say, yes, I am concerned, for families who aren't getting together as they normally would. As you mentioned, they're already experiencing tremendous stress, and we know that isolation over long stretches of time leads to loneliness and feelings of disconnection. And so, the Thanksgiving and Christmas holidays might be especially tough because beyond the normal desire to be with friends and family, these are familiar and comforting rituals. Mm-hmm. And, in addition, for anybody who's lost family members, whether due to COVID or other reasons, the holidays can often amplify feelings of loss that, because they're associated with these times of getting together. So, yeah, there will be probably a significant sense of loss. And I'd add that we already are seeing a much higher rate of mental illness and people reporting symptoms of mental illness than normal. So a study done back in June by the CDC, they found 40% of respondents, and it was a nationally representative sample of 18-year-olds and over, said they were struggling with depression, anxiety, or a trauma-related disorder. We saw a kind of startling number of people reporting thoughts of suicide. I think it was close to 11% in the normal population. So now on top of all that, we have this additional stressor of not having our normal holiday rituals. I do think there's a lot that we can do to cope. And the first thing is just to accept the reality of the situation. I mean, I think we have to acknowledge it's disappointing. People are going to be sad. But then the next question is, given this reality, how can we still create something, meaningful, something with connection and that has some joy in the holidays? And I don't think these need to be mutually exclusive. So we can be disappointed, but we can still create something meaningful. I'll pause, but it's something if you want to be, I kind of did a little searching around what other people are coming up with. I think there are a lot of options that we can talk about at some point.
Well, and I think that those are good options. I think that, my family, I have 3 sisters, I have 11 nieces and nephews. So even if we just had an immediate family get together, we are exceeding recommendations for small group gatherings. And so we've made the decision not to celebrate outside of our own households. And so we just last night had a family Zoom night just to touch base, to see each other, in person, so to speak. And so I think that you're right. It is acknowledging that it is different. It is disappointing, but that we have to take the next step to not just sit in the sadness and come up with new ways to celebrate together. So I would be curious if you've found things outside of Zoom. I think, everybody is maybe Zoomed out. So if you've found other alternatives, I think we'd all love to hear some.
Yeah, so I won't take credit for any of these ideas, but a lot of people, but I just collected a few. So here are just, everyone can make the same meal and or make one favorite dish and sort of talk about that or eat it at the same time. And yeah, you can use Zoom for these gatherings. If families live close enough by, like in your situation, you can drop off dishes at each other's home, so everyone's actually eating the same thing. For Hanukkah or Kwanzaa celebrations, you can light the menorah or the Kinara candles together. Everyone can light their Christmas tree at the same time. You could spread out holiday celebrations, do several short things, like one family member could host a sing-along or doing Christmas carols, and somebody else could host a time for storytelling or even doing religious rituals. You can send small gifts to one another and open them together over Zoom. One idea I liked was the idea of families working on shared projects together. Like you could make a holiday decoration for somebody in your family, and then make one for somebody else. They make one for somebody else. And then, so it's sort of like a collective project, and you feel like you're doing something together. I even read about one family that did a competition. They did different decorations, and then people drove around and like voted, who's was the best, and then they kind of tallied it up on Zoom. So these are, I think it's limitless. Again, you have to just acknowledge, yes, it's not the same. We're not going to have what we had, but we can still create some new rituals and do something fun.
That's great. So, keeping all of those things in mind, if families are at the point where they say, you know what, I am willing to accept the risks, I'm going to have my family get together, regardless of all of these suggestions, that may or may not include visitors from out of town, what would be the things that we would suggest to decrease risk, knowing that they're having people get together, whether they're coming from out of town, from another household? Are there things that you would suggest as far as meal service or length of time being spent together, hand hygiene, masking, things that we would suggest to people if you're going to have an in-person celebration? What would be some of the things? So Dr. Lawler, if we'll start with you, and then if we can move back to Dr. Cates, that would be great.
Sure, thanks, Angie. And understand how people would think that for them the calculation is worth the risk, because it's so meaningful to get together with family, and it's so needed. As I think David pointed out, these rituals are incredibly important. I would remind folks, however, that the risk that they assume is not just their personal risk. It's a risk to everybody in the community, because the more people that are infected in the community, the more the disease perpetuates through the community and the faster it moves. And so we know that if you are infected, you risk not only yourself and your own health, which is one thing, and certainly that's your individual purview to decide whether you think you should smoke or not. But when you subject yourself to increased risk of infection, you also subject the rest of the community to that risk. And that's not just your life you're affecting. It potentially is the life of family members or neighbors or people you don't know in the community. So I would urge people to keep that in mind as they're making these decisions. I think if there are reasons that you really do need to get together with family members, there are ways to do so that reduce the risk significantly. So keep groups and visitation small. Keep those groups of people to certainly less than 10, preferably less than 6. So maybe it's a situation where your household or a couple of people from your household go to visit a couple of people from your family, and you keep the risk pool, so to speak, smaller. Keep those interactions outdoors. We know that being indoors dramatically increases the risk of transmission. Keep those settings and those interactions with masks on, right? So maybe going to visit can be a part of the new ritual you make up, but sharing a meal at the same time maybe should not be part of that ritual, because we know when you have to take a mask off to eat, that dramatically increases the risk of transmission. Make sure that when you are together, even if you're outside, you try and keep as distanced as possible. We have the 6-foot rule that lots of people use, and that's generally a good rule of thumb if you can maintain 6 feet of distance, but keeping farther away than 6 feet is even better, because we know that this disease can be spread by aerosol, and that can travel certainly more than 6 feet. So if you are in small groups, if you are outdoors, if you are all masked, if you're greater than 6 feet apart, if you keep those interactions to a relatively short period of time, right? A half hour, maybe an hour. If you're following all those other rules, then you can reduce risk versus spending 6 hours together, right? That increases the potential exposure that you have if somebody is shedding virus. And finally, as we know, things like hand hygiene, washing your hands frequently, using hand sanitizer. If you're touching any high touch surfaces or touching your face mask, you should be sanitizing your hands. If you can do all of those things, you can significantly reduce the risk of those interactions.
Great. Dr. Cates, would you have anything you'd like to add?
I really liked what Dr. Lawler just said about even if you aren't concerned about yourself, think about other people. There is some research to suggest that we are sometimes more motivated to make changes when we actually think it'll help somebody else. So tapping into that sense of altruism. So you're making a sacrifice, but you're doing it not just for yourself or for your immediate family. You're really doing it for the community. So I think that's a helpful mindset for many people. I would also just point out there are often family members who wouldn't have been able to attend for a variety of reasons, travel or illness, that if you do a virtual celebration, that can attend. And I'll just give a personal anecdote. My daughter graduated from college this spring, and we were all going to be in New York where she went to college. And so, of course, they canceled all that and she was home. But we did this Zoom celebration, and in many ways, it was different, but it was in many ways better. Everybody went around and said something we normally don't actually hear from everybody in these meetings, so everybody got to hear. And we included people who would not otherwise have been there. So I think, again, it's acknowledging that it's different, acknowledging there's a loss, but then saying, how can we make the best of it? And in fact, we're doing this not just for us, but we're doing this for our community.
That's a great point. And I think, that sparked another question is we're moving into the holiday break and we have, kids taking breaks from college, thinking about individuals coming back to the Midwest from their college settings or, with the cases, rising so sharply here in the Midwest, for us sending students back to other areas. What guidance would you give to families who aren't going to say, no, you can't come home, but what guidance would you have for safely interacting with those individuals or for them to consider before they leave campus to go back home?
That's a Dr. Lawler question.
Sure. Great question. And I know that many colleges across the country have either enacted guidance or even rules about students traveling back home for the holidays, that they discourage that, and even some schools will prohibit students from returning to campus if they go home for the holidays. And then there are a number of colleges and universities who are ending their in-person education at Thanksgiving break, and if they're continuing on, are doing virtual only. But there still are some subsets of schools that would potentially allow students to go home and then come back. I think it's important to recognize that for the most part, there are very few areas of the country that have higher transmission rates than Nebraska. So certainly the risk of our sending students back home from schools in our area is higher than the risk of students coming from college settings. But anywhere that you are moving across geographic regions, you're obviously potentially introducing the possibility of bringing more virus into a particular area. I think that if holiday travel is necessarily part of the routine, and again, I would strongly discourage people from traveling over the holidays unless it is absolutely necessary. So again, for a college student, I would strongly discourage college students from going home for Thanksgiving and then returning to school. If they want to go home and do the rest of the semester virtually and stay through the end of winter break and until the spring semester, I think that's obviously a reasonable choice. But if you can avoid going and coming, I think that's an important thing to consider. And then as far as how to do that safely, I think that certainly getting testing around that time that you're traveling before travel, and then probably several days after arriving back home, to make sure that you've not either just caught COVID before you left, or potentially were exposed and caught it while you were traveling, is an important safety precaution. And I think limiting your exposure outside of your household during the first 2 weeks that you have returned or moved is helpful to reduce community transmission. And even, within your household, wearing a face mask while you're walking around in common areas of the house will also reduce risk. It's very important to remember that we now know that the majority of transmission events occur from asymptomatic individuals. So people who don't know they're ill because they have not yet developed symptoms. And in many cases, in young people especially, people may never develop symptoms with infection, but still may be able to transmit the virus quite readily. And so it's important to recognize you may not know when you're a risk for transmitting. In fact, it's likely that you will not. And so just because your college student feels fine after they come back from college does not mean they're not a risk for transmitting.
Right. Well, I think one of the things that, that we've seen, or that I've seen in even like older high school kids or young college students, is they'll get tested and then they don't wait for the results before they resume additional activities. And so I think it's a good time just to reinforce that, maintaining a stricter sense of quarantine and self-isolation while waiting for test results, whether symptomatic or asymptomatic, is a key component of the testing strategy. Because we often hear anecdotes of, well, they got tested on, say a Tuesday, they went out Tuesday, Wednesday, got the results on Thursday, and now we have to contact trace all those people for that 48 hours. And so I think just bringing that point up, I don't know if you guys have any additional things you'd like to add to that.
Well, I'll share, as David did, a personal anecdote that we have a college freshman who's away at college, and this will be the first Thanksgiving that he'll be away from home. And as much as we would love to have him come back and spend the holidays with us, we've said, you know what, son, it's not worth the risk. We love you, but we think you'll be safer and we'll be safer if we stay apart, and we'll get together virtually. And so that's our plan. And it's not fun, right? That's really hard, especially for his mom, her only son, spending the first Thanksgiving away. But it's really important, and we feel very strongly that that's the right decision.
Mm-hmm. Yeah, that's great. Thanks for sharing that. I think one of the other things that goes along with just kind of the emotional response that people have to the separation, I think we often think about people celebrating within their own household, but what about individuals who are single, right? So they don't have family, they don't have a partner, they don't have a pet, maybe. So I don't know if David or James, you guys have suggestions on how can people who don't have those built-in support systems around the holidays really stay connected? Are there resources or strategies that you would suggest for them to not feel so isolated when they don't have people at home to celebrate with?
Yeah, sure. Before doing that, I just make the point also, this probably wasn't the case in Dr. Lawler's family, but sometimes people don't agree in families or extended families about what to do, right? And so on top of all of this stress, you could actually have some conflict within families if there are disagreements about whether to get together or not. And I just think it's important that when we have these discussions, the goal is not to change the other person's mind. I think we get into a lot of trouble when we actively try to change someone's perspective. It's really just to clearly state how you feel about it and acknowledge that you understand how the other person feels and acknowledge the disappointment, but you're still setting that boundary and, and that limit that, but we're not comfortable, so we're not going to do it this year. But as far as, loneliness, and you kind of brought this up before, Angie, loneliness is a problem in this country. Some people before this pandemic were talking about loneliness as an epidemic in the United States. The average size of people's family units is smaller. Their social connections, when they actually measure like how many people you interact with in a period of time, is like a third smaller than it was back in, say, 1985. And that's due to a lot of reasons: smaller families, a lot of people traveling away from home, so they're not in those smaller, tighter networks, having fewer children, other reasons. So yeah, it's an existing problem that's being amplified, and all of the techniques we talk about for coping in general apply here. So again, it's particularly around the holidays, it starts with just acknowledging, recognizing, yes, this is disappointing. You're not trying to fight it. Don't pretend it's something that it's not. Only after you've accepted it can you sort of move on and come up with alternatives. I think it's important to identify what's the most important thing about the holidays for me. You know, what am I most missing? Is it the connection? Is it the food? Is it the travel? You know, what are these things? And then you come up with your, next best alternatives, not pretending it's the same thing, but you just get creative and you figure out ways to try to achieve some of what is most meaningful in the holiday. And in general, staying connected. You know, we know that social connection is probably the most important buffer to stress. If there's one technique I would, if I had to pick one thing for people to do, is to stay connected. But if it's not physically, using all the other technology and other means of being connected.
And Angie, to add on to that, because loneliness, especially in the holidays, is such a huge problem, and challenge for mental health. There are creative ways to plan and organize actual in-person interaction. If you take enough time and you work through the details. So while bringing multiple households together and larger groups, again more than 6, really increases risk. If you're talking about bringing one person who may live alone over to a household of 2 or 3,
right.
And it's done with a lot of meticulous planning beforehand. So restricting exposure for the 10 days before that happens, only going out when completely necessary, only going out when you're wearing a face mask, getting a test before, 48 hours before you actually have the interaction of everybody involved. Those things can all mitigate risk. And then if you follow those rules we talked about, that if you're going to be together, try and keep that together time outside with masks on. And certainly if you're going to be eating and doing things without masks, definitely be outside, but further apart. But that doesn't mean that you couldn't go through all of those preparatory steps and then spend an hour with somebody, with face masks on, socially distanced. Just that in-person proximity, I think, could be, really helpful for folks. And again, it can be done in a way that keeps risk at a very low level.
Absolutely. No, I think those are really great suggestions. And I think a lot of times people are feeling so stressed and overwhelmed, and they're hearing all of these directives and they're not really maybe taking the time to process through, well, what can I do? And so I really do think it's shifting that perspective a little bit. I think I have one final question that I think will apply to both of you. And, as we prepare to welcome in a new year, are you hopeful that 2021 will be the year that everything returns to normal? Or should we all be preparing for a new normal? And I think, particularly around people pinning their hopes on a particular date or a particular time and then becoming disappointed when those dates pass and no change occurs. Wanted to get both of your perspectives on kind of that question, and then just things that you would relay to folks as we're moving into a new year.
Well, I'll answer quickly and then I'm going to have to run. But I doubt that anybody, I certainly don't know anybody who's going to list 2020 in their top 10 favorite years, right? So 2021 will definitely be better. I do think that by late 2021, by this time next year, things will look dramatically different and we'll be in a much better place as far as the pandemic goes. I think we'll have a large number of Americans vaccinated. I think we'll be able to return to many more normal activities. We'll be, still be recommending face masks in some situations, probably still at that point. But we'll be getting really close to kind of back to what the new normal is. Hopefully, we'll build some additional protections and precautions into how we do daily life to prevent something like this from happening again. But I think we'll be able to get together with family and do normal holiday type things next year. So I do think that, yes, by spring and summer, we'll be in a much, much better place. But it does mean that we really have to buckle down for the next couple of months. So thanks, Angie. I'm going to have to
Thank
run.
you, Dr. Lawler.
I'd just add that, and I'm glad Dr. Lawler said that, because I do think having hope psychologically is critical to coping, and I think it helps to envision and start talking about, and even start, tentatively planning what you'll do next year, how you might travel, how you might celebrate the holidays with family. Obviously, nobody knows what things will be like, but as Dr. Lawler said, there are hopeful signs, and building on that hope and starting to think through what we'll do next year can truly lift our spirits and can be something that gets us through this more difficult year.
Absolutely. Well, I want to thank you for taking the time to chat with me today, and really to really that I hope that everybody found something of value in today's conversation. It's very much appreciated you spending the time to talk through some of these helpful tips for how to celebrate the holidays safely. And we would love to hear from our listeners. If there's a topic that you have on your mind, or there's a conversation that you'd like us to have with one of our subject matter experts, or questions we can help you find answers to, please send your ideas to nbu@nebraskamed.com. We're happy to hear from everyone, and thank you all for listening. Have a safe and happy holiday season.